Okay. To start, I should clarify that Stark's cleft lip and palate were non-syndromic, and that Barb was happy to continue exclusive bottle feeding her express breast milk. Reviewing the findings from the protocol and articles as they apply to this case, it's important to note that oral feedings are recommended right after cleft surgeries that have no complications. It's good for parents to work with their cleft lip and palate team specialists, and referral needs to happen when appropriate, especially early on, to help detect any issues that can occur with cleft lip and palates. Such issues that are very important are submucosal clefts, which they did end up finding Stark had. Also, it's important for parents to be connected with other parents of children that have cleft lip and palates. Now for the results of the case study. Stark lost 10% of his weight in the hospital, so he was within normal limits, but because of the cleft, they wanted to make sure they had feedings figured out and were heading in a good direction with his weight gain. His weight at 2 weeks would have probably been in the normal range and back to birth weight if he hadn't have developed the reflux. At that point in time, if he were able to drink all of the 3 ounces in the bottles that he was receiving, it would have also been within normal limits for intake. What ended up happening was the lactation consultant showed Barb some other options for special needs bottles that work great with cleft lips and palates. Barb decided that she wanted to try the Medela special needs bottle, previously known as the Haberman. And the lactation consultant referred Barb and Stark back to their occupational therapist and speech-language pathologists about the aspiration that was occurring. OT and SLP fit Stark right in for a swallow test, and they were happy with the results. Anatomically, things were fine besides finding out about the submucosal cleft, and they started him on the reflex medication. OT agreed that maybe the Medela special needs bottle was better for Stark since you could control the speed of the rate of flow a little bit more. Follow-up appointment with the lactation consultant at 3 weeks led to them ordering some other flanges for Barb, size 20, that totally resolved her nipple soreness. And the lactation consultant made sure to reassure Barb that her milk is and was the best thing for her baby. Stark just needed some reflux medication to help in the soothing of his reflux that was occurring. The lactation consultant connected Barb with a local Facebook group that was really helpful for Barb, and she even ended up developing some lifelong friends. They added in another pumping session into Barb's night to help protect her milk supply because she had been sleeping for 6-hour stretches, and the lactation consultant explained that at this point, not going longer than 4 hours without pumping would be in her best interest to help support a robust milk supply. Stark gained the weight that was needed to be able to get the lip correction surgery and be within normal limits. He received that surgery at 2 months of age. At 1 year old, Stark was able to get his hard palate correction surgery, and when he was 2, they were able to have the soft palate correction surgery. The timing of these surgeries were within the times suggested by ABM's protocol for cleft lip and palates. They fed him right away after all these surgeries, which was also within suggestion of ABM's protocol. Overall, her supply did dry up at 10 months, but because of her freezer stash, she was able to complete the goal of feeding him exclusive breast milk for the first year of life. And today, Stark is a happy, healthy, and robust toddler.